6 months ago, a woman named Evelyn walked, or rather, struggled to shuffle, into my clinic in Burlington, Vermont. She was 68 years old, and her eyes were filled with a kind of defeat that I see far too often. She told me, "Dr. Thompson, the surgeon says it's bone on bone. My kids are looking at nursing homes because I can't even walk to the mailbox anymore. Is this how it ends? In a wheelchair, doped up on painkillers." Evelyn was convinced her life was over. She had been told that cartilage doesn't regrow, that her age was her enemy, and that surgery was her only hope. But when I looked at her charts, I saw something else. I didn't see a broken woman. I saw a body that was starving for the right biological signals. Fast forward to last Tuesday. My phone rang, and it was Evelyn. She wasn't calling from a hospital bed. She was calling from the top of Mount Philo. She had just finished a 2-mile hike with her grandsons. No surgery. No heavy narcotics. How did she do it? She didn't use a miracle drug or a secret expensive supplement. She used a simple, natural method, a specific dietary protocol that 97% of my colleagues in the medical field completely overlook. They are so busy looking at the X-ray that they forget to look at the biology. Today, I am going to reveal exactly what I told Evelyn. I'm going to guide you through the detailed implementation of the anti-aging foods diet for knee cartilage. Because whether you're 55 and feeling that creak, an office worker whose knees ache after sitting, or a new mother whose joints feel like jelly, there is a way back to strength. Before we dive into the science, I want to know who I'm speaking to today. Every body is different. Please, stop the video for a second and go down to the comments. Type in your age, one health metric, like your weight or blood pressure, and your primary symptom. Is it a sharp pain, a dull ache, or a clicking sound? I read these comments personally. They help me understand the community we are building here. Now, listen closely. If you are feeling this pain, I want you to erase the word genetics from your mind for a moment. I want you to stop blaming old age. In my 30 years of practice, I've found that knee degradation is rarely about your birth certificate. Instead, it is almost always due to a deficiency in 4 specific categories of nutrients that your cartilage needs to stay hydrated and resilient. For those who are new to the channel, I am Dr. David Thompson. I've spent over 3 decades in the trenches of clinical medicine, treating thousands of patients who thought they were beyond repair. My mission with this channel is simple: to empower you to live a healthy, independent life through the power of scientific nutrition. I'm not here to sell you a quick-fix pill. I'm here to give you the blueprints to rebuild your health from the cellular level up. I've seen the miracles that happen when we stop poisoning our bodies and start nourishing them. Let's see where you stand right now. I want you to perform a quick mental self-test. I'm going to list 5 common symptoms. Count how many of these you experience on a weekly basis. 1. The morning rust. When you first wake up, do your knees feel stiff for the first 10 to 20 minutes, as if they need oiling? 2. The staircase signal. Do you feel a sharp pinch or a dull ache specifically when going downstairs? 3. The popcorn effect. When you squat or stand up, do you hear a distinct clicking, grinding, or crunching sound? 4. The rain cloud radar. Do your knees start to ache or feel heavy when the weather changes or the humidity rises? 5. The sitting stiff. After sitting at your desk or in a car for an hour, do you find it difficult to fully straighten your leg on the first try? How many did you get? 1, 3, all 5. Comment that number below. If you have even 2 of these, your body is screaming at you. The root cause isn't just wear and tear. It's a combination of 3 things: ischemia, poor blood flow to the joint; oxidative stress, free radicals eating your cells; and chronic inflammation. Think of your cartilage like a sponge. When it's healthy, it's wet, bouncy, and full of fluid. These three issues turn that sponge into a dry, brittle piece of cardboard. Today, we are going to soak that sponge back to life. The first, food, is actually a root that has been used for centuries, but only recently has modern science understood why it is a powerhouse for cartilage. I'm talking about turmeric, specifically its active compound, curcumin. Take Mark, a 55-year-old accountant. Mark spent 10 hours a day at his desk. His knees felt like they were filled with broken glass. He was taking 800 milligrams of ibuprofen daily, which was starting to destroy his stomach lining. I put him on a specific turmeric protocol. Within 3 weeks, Mark called me. He said, "Dr. David, I just drove 3 hours to see my daughter, and when I got out of the car, I didn't have to limp." Why did it work? To understand this, imagine your knee joint has a master switch for pain. This switch is a protein complex called NF-κB. When NF-κB is on, your body produces a flood of inflammatory chemicals called cytokines. Curcumin is a natural switch flipper. It enters the cell and physically blocks NF-κB from turning on. It's like putting out a fire at the source rather than just trying to fan away the smoke. A landmark study published in the Journal of Medicinal Food in 2016 performed a systematic review of randomized clinical trials. The results were staggering. Curcumin was found to be as effective as standard NSAID painkillers, like ibuprofen, for joint pain, but without any of the gastrointestinal side effects. You cannot just sprinkle a little turmeric on your food and expect a miracle. Curcumin is hydrophobic. It hates water and is poorly absorbed. The golden recipe: 1 teaspoon of organic turmeric powder mixed into a warm cup of coconut milk. Fat is essential for absorption. The secret ingredient: you must add a pinch of black pepper. Black pepper contains piperine, which increases curcumin absorption by 2,000%. Golden time: drink this in the evening. This allows the anti-inflammatory compounds to work while your body is in its repair phase during sleep. Have any of you tried golden milk before? Did you remember the black pepper? Let me know in the comments. Next, let's talk about something your doctor probably never mentions: dark leafy greens, specifically arugula and spinach. Meet Sarah, a 42-year-old mother who recently had her third child. Between the hormonal shifts of postpartum and the constant lifting of a toddler, her knees felt loose and weak. She felt like an old woman. By incorporating high-nitrate greens into her smoothies, she regained her joint stability and spring in just 1 month. Cartilage is avascular, meaning it doesn't have its own blood vessels. It gets its nutrients through a process called diffusion from the surrounding fluid. If your blood flow is poor, your cartilage starves. Leafy greens are packed with dietary nitrates. When you eat them, your body converts them into nitric oxide. Think of nitric oxide as a road widener. It relaxes your blood vessels, allowing oxygen-rich blood to reach the tiny capillaries near your joints. It's like opening the floodgates to a dry garden. The Journal of Arthritis and Rheumatology, 2013, highlighted that vitamin K, found in abundance in these greens, is critical for bone and cartilage metabolism. Low levels of vitamin K were directly correlated with an increased risk of developing knee osteoarthritis. Practical guide. The dosage: aim for 2 cups of raw greens daily. The combo: nitric oxide production requires a spark. Squeeze a little lemon juice, vitamin C, over your greens. The vitamin C prevents the nitric oxide from breaking down too quickly. Golden time: lunchtime. This ensures peak blood flow while you are active during the afternoon. Note: if you are on blood thinners, like warfarin, Please consult your doctor before significantly increasing leafy green intake due to the vitamin K. The third solution looks remarkably like the organ it helps protect: walnuts. Robert, a 72-year-old retired carpenter. His knees had crunched for 20 years. He thought he was out of options. We added a specific amount of raw walnuts to his daily routine. After 6 weeks, he reported that the grinding sound had diminished by nearly 50%. He described it as his joints finally feeling greased. Walnuts are the king of alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid. In your body, ALA is converted into substances called resolvins and protectins. Just like the name suggests, these resolve inflammation. If curcumin is the fire extinguisher, omega-3s are the internal WD-40. They help maintain the viscosity of the synovial fluid, the oil that keeps your hinges moving smoothly. A 2018 study in the American Journal of Clinical Nutrition found that individuals with higher intakes of omega-3 fatty acids had significantly more cartilage volume, measured by MRI, than those with low intake. It literally keeps your cartilage plump. Practical guide. The dosage: 7 to 10 whole walnut halves per day. No more, as they are calorie-dense. The rule: they must be raw and unsalted. Heat, roasting, destroys the delicate omega-3 oils, turning a healing food into an inflammatory one. Golden time, mid-morning snack. It stabilizes blood sugar and provides the fats needed for joint lubrication throughout the day. Do you prefer walnuts, or are you more of an almond person? Hint: for knees, the walnut wins every time. Finally, we have the molecular armor of the fruit kingdom: wild blueberries. Linda, 61, struggled with weather-related knee pain. Every time a storm rolled in, she was bedridden. She started the Blueberry Shield protocol. Within 4 weeks, she noticed that the barometric pressure changes no longer sent her reaching for the medicine cabinet. Your cartilage is under constant attack by enzymes called MMPs, matrix metalloproteinases. Think of these like little Pac-Men that chew away at the collagen fibers of your knee. Blueberries are packed with anthocyanins, the pigments that give them their dark color. These anthocyanins act like internal sunglasses or a shield, neutralizing the free radicals that activate those Pac-Men. They protect the structural integrity of the collagen matrix. A study published in the journal Nutrients in 2019 showed that daily blueberry consumption for just 4 months led to significant improvements in walking speed and a reduction in self-reported pain for adults with knee osteoarthritis. Practical guide. The dosage: 1 cup of wild blueberries. They have 2x the antioxidants of regular cultivated blueberries. Frozen is fine and often better. The combo: eat them with a small amount of protein, like Greek yogurt or a few seeds, to prevent a blood sugar spike. Golden time, breakfast. Set your antioxidant shield early in the day before you face the stresses of movement. My friends, the journey to healthy knees doesn't start in the pharmacy. It starts in your kitchen. We've talked about 1. Turmeric to flip the inflammation switch. 2. Leafy greens to open the nutrient highways of your blood flow. 3. Walnuts to provide that essential internal WD-40. 4. Blueberries to shield your collagen from being eaten away. If you implement even 2 of these changes this week, you are doing more for your future independence than any magic pill could ever offer. Please, don't wait until you are bone on bone like Evelyn was. Start today. Your 80-year-old self will thank you for the mobility you are preserving right now. If you found this helpful, please subscribe to the channel and hit that notification bell. We have a whole series coming up on anti-aging for the spine that you won't want to miss. I have a challenge for you. For the next 7 days, I want you to have one joint healing smoothie containing spinach, blueberries, and walnuts. Come back to this video in a week and tell me how your morning stiffness feels. I'm Dr. David Thompson. Stay active, stay nourished, and remember, your health is in your hands. I'll see you in the next video.